So good afternoon to everyone. We are very happy to know that many of us are here today for the presentation of the new CPMS 2.0. It is a very important day for ReCONNET, as this, we hope, will be a big change in the way we discuss our clinical cases in our network. So I'm very pleased to be here today, together with Vanessa, to show you what the new CPMS is. So today, my job will be the job of a coordinator, to engage you on the use of the CPMS, but also to show you where we are going, what we would like to accomplish, and which are the next steps. And Vanessa will show you the work she and her group have done in the support of the development of the new CPMS. We will also have time for questions, because we expect that you will have lots of questions on how to use the CPMS. And if you have doubts, please ask questions, because you will see how important it is to use the CPMS for all the ERNs and for our mission, that is to better treat our patients. Just to remind you why myself and Vanessa, because as you may recall, this time our grant is a multi-beneficiary grant. This means that many of the activities that are included in the work packages of the ERN grant are divided. And so not only PISA is covering all the activities, but as you know, as you've already realized, there are other centers who are doing some of the activities of the work packages. And so Vanessa is a beneficiary for the work package 4, that is the work package of the CPMS and the discussion of clinical cases. I truly think that this new CPMS will be really the great change of the cross-border discussion of clinical cases for rare diseases. For those of us who have been in the ERN since the beginning, we know that there was already a CPMS, and we have been using the CPMS, but with some issues and some problems. Usually the old CPMS required a lot of time to introduce data and to discuss clinical cases. The Commission was really aware of these issues. And so what has happened with this second grant, even a little bit before actually the actual multi-beneficiary grant, is that they started development of the 2.0 CPMS, taking into account not only our issues, but also trying to develop a platform that was adapted to the different diseases. So it was not one size fits all, but trying to really give an answer to the specificities of the different rare diseases. So, as you know, CPMS stands for Clinical Patient Management System. Now we call it CPMS in a friendly way, and it is a secure web-based platform that was developed to discuss the clinical cases within the ERN centers. We all know that the core of the story of the ERN is share, care, and cure, and is the concept that the information travels and not the patient. And the CPMS is really the example. Instead of having our patients traveling, we discuss about our patients on this management system, and then we decide if the patient have to travel. So the CPMS has the job of bridging expertise across Europe, enabling the multidisciplinary and virtual case discussion across borders, and is really the backbone of our collaboration. So it is a platform that really connects us all and connects the ERN centers, but also the ERNs. So what we will see is that we also want to involve in our discussion members of other ERNs, because they have an expertise that we may need. It was, as I said, developed to improve the life of patients with rare diseases, so less travel. Specialists come to the patient, and the patient is at the center of this process. And what it is very important is that, and this is a thing that we need to be very aware of, it is a very safe environment. This was the very most important thing about the safety of the data included in the CPMS. So really, to summarize, there are benefits for patients, which are very clear in the use of the CPMS. So the access to expertise everywhere. So patients are connected with us, with the European specialists, and this is without leaving home. Where they live, they have the expert. And the idea of the CPMS was also to have a faster diagnosis. And this was a little bit an issue with the old one. We need to be very rapid. We need to provide the information in a very fast way. And we think that this can be really accomplished, and this will be what we have to do. We think, and it is clear that if we use the CPMS, we move forward for the equity in care. So what was one of the aim of the ERN? It was to provide the same care across different countries in Europe, and the ERN is a tool to do that. Less travel and less stress. We have learned with COVID, we all do telemedicine today in our clinic. Well, think ERNs have developed telemedicine, which now we use after COVID, before COVID, because we started before COVID, and in a safe environment. So for patients, no issues about safety. For us, there are lots of benefits on the discussion of clinical cases on the CPMS, because obviously we take an advantage of sharing the expertise of colleagues instead of emails, actually. And we can have a very clear consultation with colleagues. We can also refer patients if we need to a more specialized center than ours, because even in excellent centers, there may be differences. And I believe that when we discuss clinical cases in a multidisciplinary manner with colleagues, we learn. So we increase our expertise as well. The tool is really, really friendly, and well, it is very important for the network. So we start to see that for us, there are lots of advantages. So what it is, this new CPMS? It's a very secure and GDPR environment. It is a platform that is designed to support the medical collaboration and discussion, is very flexible, and is easy to use. You will see Vanessa has prepared a presentation to show to all of you how easy it is to use. So please do not be scared. We know that very, very often we say that with these activities, we increase the burden of what we have to do because we all work in our clinics. But with this new CPMS, there is less burden of use for us. And as I said, there are lots of advantages in the use of the CPMS. Why I'm saying this? Because the sign up is simplified. We can even use the CPMS with our mobile, because, you know, in the CPMS, there is the discussion of clinical cases, but we could also chat on clinical cases. So for the easy chats, let's put it this way, if there is ever an easy chat around the patient, I don't think so, but we can use a mobile version of the CPMS. Importantly, we can invite the ERN experts from other ERNs. So the cross-ERN panel, we've been discussing a lot about the the collaboration between ERNs. And I think that this collaboration starts with the discussion of clinical cases, particularly if we think about rheumatological cases. They may be seen the first time by many different specialists. So it is very important that that really we discuss with different ERNs. We can really schedule very well the meetings. We have a tool for the chat and the messaging, and the privacy is absolutely controlled and the system is secure. So the new thing is that we can use the CPMS within the ERN, and this is nothing new actually. This is what it was. We were used to use the ERN, inviting colleagues from full members or affiliated for the ERN, but we were always discussing, I mean, in a way that we are the experts. We may not be in need of discussing a clinical case, which is not what I believe, but the scope of the ERN was to open to centers in which there is no expertise. And this is what now can happen. What now can happen is that we can accept guests for case enrollment. So those who are outside the ERN now really have the opportunity through us to access to the CPMS. And even though now it is not really the moment to get into the joint action and Jardin, this is really a way of integrating what we do in our countries, what our national labs are doing with the ERNs. Because now we see that the platform is there. We work in our national healthcare system, and we, through the CPMS can bring our system to Europe through this platform. So this, I think, is really very important. So what do we have to do? Now, these are very important things because the CPMS is the heart of the ERNs, I would say. We do lots of things in ReCONNET, but the CPMS is really what, as I was saying before, tells you why we are here and what is our business. Our business is treating patients. So as ERN centers, we need to subscribe to the CPMS 2.0. So you need to subscribe to CPMS 2.0 and to participate in patient cases discussion. You are also invited to nominate members of your multidisciplinary team to participate in the discussion, because we all have great experts in specific organ involvement of connective tissue diseases. We want our experts to be available for all the patients, not just the patients in our hospital. And so we need to build our multidisciplinary team within the CPMS. And you need to disseminate the CPMS because, as I said, the CPMS is available through you for those centers who are not part of the ERN. So, and this is a very important thing, as ERN members, you are supposed to participate in the CPMS. This is a kind of a job that you have. When you signed for this work in the ERN, you signed up also for the participation to the CPMS. And what it is important is that we are designing a reimbursement procedure. So not a lot of money, but you will also be receiving...
Remissione sfortunata minima e gli skill pitch o chi deve inserirlo? Ha detto il prof.
Close your audio, please. A reimbursement procedure. And what is very important, you will be invited to participate to understand what is the HCP performance system. We are requested to see the performance of all the HCPs of the ERNs, and we have developed a procedure, and the participation of each HCP to the CPMS will be monitored as part of your involvement in the ERN. As I was saying before, this is also very important for the integration. So we do have a new web page on the CPMS on our website, which you can reach. And we have organized the trainings on CPMS for our clinician of the ERN. So you will be receiving these slides, you will be reviewing this, take a picture if you want, or a screen. There are lots of opportunities to join the training session because now you need to do the job. You need to sign up and you need to use the CPMS. We also have on Basecamp all the tutorials and the guides and the dissemination material and the information that you may need to start your journey within CPMS 2.2. And here you see the information for technical and non-technical support. Which are our next steps in ReCONNET for our HCPs? We request an access to the CPMS with the EU login, and we need to go through the EU login, and I know someone may have issues, but this needs to be solved, if not already registered. You need to complete the request and access to the CPMS, participate to the training sessions, and joining the workshops and webinars so that you know how to use the CPMS. And then you need to start enrolling clinical cases. You will know we do not request to discuss 100 clinical cases per year, but yet we need to discuss the clinical cases for each member to be considered an active member of the ERN. You will be invited to discuss the clinical cases based on the expertise that you have and you declared when you became part of the ERN. We also expect that you give us feedback because we can improve things if we work there together. So obviously nothing is already done and is finished, and it's always a process that is improving over time. And you need to be sure to connect to the HCP performance system presentation because the CPMS will come back again, and you will know what it is requested to you to continue to be a ERN member. And so I'm pretty convinced that this 2.0 is really the big change. We have not performed as well as in many other activities in ReCONNET with the CPMS, but many other ERNs have not performed as they should have done, and now it is the future. So with this, I think, I mean, as we are in ReCONNET, we've been one of the best ERNs. I think we will succeed very well with the discussion of clinical cases. And I think that after a learning curve, we will find this amazingly useful for us and for our patients. So now, Vanessa, I leave it to you because now you will really show the baby and how everything works, and then we will open to questions.
Thank you so much, Marta, for your very inspiring presentation. Dear colleagues, I'm so happy to see you this afternoon, and it's my pleasure to present to you a demonstration as Marta asked. And this is, as Marta already told you in the beginning, the work of a whole team, more specifically of Marta, of Diana Marinello, which you know very well, also of Eva de Gouwe, a pediatrician, who will be mentioned a lot of times during this lecture, and she will do all to be here also today, and also of Yves Piet, a rheumatologist and our president-elect of the Belgian Society of Rheumatology. Both of them are the managers and are available for you any moment when you will be starting with CPMS. Let me guide you through a demonstration of CPMS point 2 on behalf of the whole group. So once you're registered and you go to CPMS 2.0 through Google, you see this online. And here you see the login button. When you will log in, we suggest you choose the option to authenticate yourself, EuroLogin mobile app QR code. When you will press on this option, and I will show this to you on the next slide, you will see a QR code. To scan this QR code, you will first need to install on your mobile phone an EuroLogin. Online, you can find how to download the EuroLogin app. And I will maybe ask after my demonstration to Yves to share with us what issues some colleagues of us, because we already have 160 users in this system, have had with downloading this EuroLogin app, because this was a technical issue, but he will tell this to you after the end of this demonstration. So you go online, you Google CPMS point 2, you click the option QR code, and then you see this. You take your iPhone with your EuroLogin app, you scan this code, this QR code, you get a code on your screen, and you plug in the code that you get on your iPhone on your PC. Here you see that I plugged in the code, then you can sign into the system. So I signed into the system last Friday when Marta asked me to give a demonstration of how we use this system at this very moment. Here you see the homepage of Vanessa. And what do I see on my homepage? Well, on the Friday, we always have a recurrent meeting. This is a signal for recurrent. MDO means multidisciplinary team of systemic sclerosis. I click on this link every Friday evening at 5:30. And what do I see every evening on 5:30? I see my colleagues of the multidisciplinary systemic sclerosis team. Here you see my very tired PhD student, Tessa. Here you see my cardiologist. Here you see myself. And here you see our pulmonologist. We are discussing here our patients because every Friday we discuss all the patients that each discipline has seen on a multidisciplinary team. We used to use MS Teams for that, but that is not GDPR approved. This is why we decided to start using the CPMS. At this moment in the discussion, at 6:05, our pulmonologist says, well, listen, guys, I want to share with you the HRCT to decide on the management of this patient. He goes to this button, the plus button, he presses on this, and this allows him to share his screen, and he shows the HRCT of the patient. We discuss the case, and we go through the next case. I already wanted to show to you one option we are currently using in the Ghent University Hospital, which is multidisciplinary teams between different stakeholders within the hospital. It looks very easy. It is also, as Marta said, very easy because you click on one link and you see each other. But I also need to mention that there might be in the beginning some technical difficulties. This is, for example, a technical difficulty that my PhD student Tessa had. She could enter the system, she could see us, but she couldn't hear us. Don't be worried if you have a technical issue. You can mail this email address, Santé ERN CPMS, IT support, and they do reply within 48 hours and they do help. So what Tessa sent to them is that she has difficulties logging into the CPMS 2 meetings because she could not connect to the audio, whatever browser she used. Am I, in these 20 minutes, going to show to you any technical issue that our team, Eva, Yves, Diana, Marta, had with any of us these past months? No. What we suggest to you is to start using the system, and if there's an issue, to solve the issue, because you will be guided step by step through the issue. So in a nutshell, I am trying to tell you, don't worry to start using the system. How to organize meetings? Well, also very easy. You go to your homepage, you click meetings, and then you just have to plug in the date that you want to have the meeting, the start time. You can add any participants and the agenda. So it's, as Marta already anticipated, a very practical, easy to use system. This brings us to the second part of the demonstration. What else do we see on the homepage of Vanessa last Friday? Well, here you see a patient record. You immediately can see this name on the left, Lily Captain 796 is not a real name. As Marta anticipated, for GDPR reasons, we have nicknames for all our patients. So I look on Friday, I see Lily Captain, sent to us by the Antwerp University Hospital, which is not a reference center. I go to my actions. What do they want from us? So I click here, and I see here the details of the case. It's about a female of 17 years old, and this record was made the 16th by a colleague from Antwerp, a pediatrician, who wrote to Vanessa, I have a 17-year-old patient with severe dyspepsia. This girl also has Raynaud's phenomenon, puffy fingers, livedo, arthralgia, fatigue, a malar rash. Her ANA is negative. Her sclero and Mayo panels are also negative. HRCT is negative. Lung function is normal, but capillaroscopy shows 2 giants. Can I start Plaquenil? Here, Vanessa replies, Benson, I need to see these pictures because I don't feel comfortable deciding on something I don't see. So what does Benson do, our colleague? He very easily plugs in files. And here's a first file where you can see the malar rash with the sparing of the nasolabial fold. I press the next file. Here I see some what I think are Gottron papules. I show that to Yves, and he says, well, maybe we can take a biopsy of that. Here we see what Benson had written, more specifically that the local capillaroscopist saw giants. So Vanessa replies, measure these apical diameters and then tell me if it's real giants or not. We chat with each other in the chat function. Here, for example, you can see that Vanessa says, take a biopsy of the Gottron papules. And then I say, well, I discussed internally also with Yves. And yes, if these are real giants, then we understand that you want to start Plaquenil, even though we would have waited 6 months, but you can start Plaquenil, and we consider her as a UCTD. So Benson, a pediatrician from Antwerp, can continue with his girl of 17 years old, and we have given our advice. So this is the second thing you can do with the CPMS. As Marta anticipated, we can help our colleagues from external centers. We can give them advice without having to make the patient travel. This was the demonstration of how we at this very moment use the system in our university hospital. I've spoken to you about the EuroLogin. Eva made a wonderful video on how to do this EuroLogin, and all documents you can find under Basecamp. But when you will start using the system, at least when I started using the system, I had hundreds of questions. So what Marta, Diana, Eva, and Yves did is they collected these questions and put them into CPMS, frequently asked questions. I'll go over some of these questions in the next 2 slides without replying to all of them, but just to show you that there's an elaborate list of questions and all of these have been replied to. For example, what is this CPMS platform? What browser to use? And how can I request access to CPMS? How to create your login? And then practical stuff like how do I change my email address, or how do I change my phone number in the EuroLogin details, or I have a new mobile device now, how to move on. And then the daily questions, how do I enroll a patient? How do I add files to patient record? Because I just showed you that the pediatrician of Antwerp uploaded the patient files and pictures, and I asked him afterwards, Benson, how long did you take? He said 10 minutes. So Marta is right, this new system is really easy to use. Other questions, how to invite experts, I'll also show you in a minute, but this is also explained in the frequently asked questions. Where are the conclusions of patients' discussions saved? All of that you can retrieve in the frequently asked questions. And then there's also questions more on policy level. What is GDPR? What is a consent? And is this patient consent really necessary? Yes, it's necessary, and we need to stack it locally for monitoring reasons, but all of this, again, is very nicely explained in the frequently asked questions. Some other questions I had is, for example, did the European Commission carry out a data privacy impact assessment? That's all explained. Yes, of course they did, but that's all explained. So just to show to you that whatever question might pop up in your head when you start using CPMS, it's all very nicely explained and very easily retrievable. I have spoken to you about consent forms. These are also very easily retrievable on Basecamp. And tutorials on anything concerning CPMS, from how to register, to get an EuroLogin, to upload cases, a lot of tutorials and videos have been made by Eva, and these are all very easy retrievable. If you have any questions, and be sure that when I started using this, had the most stupid questions because I'm an ICT nerd. Any moment you have any question, you can send a mail to Eva. And I think she'll be here by now. And you can also send an email to PISA. This is a temporary address. There will be soon a new official help desk of ReCONNET. I'll show these email addresses also in the end so you can take a picture, because if you start using the system tomorrow and you have questions, you get a reply of Eva or Diana within 24 hours. So now how to add a new patient. You go to your homepage, you add a new patient. You cannot move past this page if you don't fill it in. So you need to ask your patient, before you upload your patient, a consent to be uploaded in the CPMS. And then also, we always ask our patients, can this information be used for education purposes? The case I showed, for example, of Benson, his patient had given consent to use this as education purposes. And very importantly, for those who attend our working group of registries, you can also ask your patient if he or she gives consent to include this information into registries. Once you've clicked these, only then you can move on in CPMS. So let's move on. The system will create for you a nickname by clicking on this link, and they are very beautiful nicknames. This patient, for example, is Move Tolstoy 106. Then you need to give information about the healthcare provider and the record lead, the one who uploads the record. And then you have to give information about the thematic area. In the case here that you see on my screen, it's a solid tumor and it's a brain tumor. This helps the system to find experts, as Marta already anticipated, across other reference networks. Because as Marta told you, the system is not only used within our ERN, but we can search across all 24 networks. And this is how we do that. You want to find experts, and we don't know all experts from other networks, but you can search by European reference networks if you know all 24 networks by heart, but I don't do that. But you can easily search across thematic areas. For example, for me, that would be systemic sclerosis or ILD. When you plug in the thematic area, the IBM has made sure that automatically you get displayed names of all experts of all appropriate reference networks across Europe. And then you can easily click them and you can contact them. There's also something else. Marta just told you that Diana will send an email end of June or beginning of July to ask to you to find within your own university hospital experts and give those names to Diana, so she has a local goldmine of experts who can reply to questions from people outside our university hospital. If this all seems too difficult to you, I thought it would be too difficult, but even I can use it. But if it still seems too difficult, you can have an assistant in your healthcare provider hospital to help you with uploads, to help you with panel management, and to help you with consent taking. All that I have told you is not only retrievable on your mobile phone on Basecamp, but it's also retrievable on the website. Diana has put any video that is available, and you can see them nicely pointed out here on our website. And Diana was so kind to also put all dates for training sessions on the European Reference Network for Rare Connective Tissue Diseases websites, and you can find the dates here. So what's the conclusion of our whole CPMS teams? As Marta already said, let's get started. And my conclusion is, please don't worry. I suggest that you start slow, as we did in Ghent, to tweak out the technical issues that you might have in the beginning. And what we will do in Ghent is continue with other multidisciplinary teams in our university hospital and replying questions of other MDs in Belgium. And after the summer, if this works well, then we will expand and start working cross-border. Having said this, I would like to thank you enormously for your attention. I am as enthusiastic as Marta. I promised you I would put the mails that are important here. So you have the mail of Eva, you have the mail of Diana, and when there's technical issues, you have the mail of the technical help desk. Having said this, at this very moment, I have here our managers, Yves Piet, please show your face, and Eva, and they will be happy to reply to you together with Diana on any technical questions you may have for the team. Thank you so much for your attention.